kind of wanted to personalize this and give you an example of what really is involved in testing someone. And so if someone comes in to a doctor's office, or they've called in and said and told to come into the doctor's office, the things that we look for are someone with a travel history, of course, and people that have symptoms of high fever and cough or shortness of breath. And so the idea is to sort out which people actually need the COVID-19 testing and to become labeled persons under investigation. So what is done is usually an assessment of that patient, and then if we think they need to be tested, we want to rule out other things first on examination, and often by doing influenza testing that can be done in the office and also in the urgent cares and in the emergency department. And again, we're not encouraging everyone with a cough or fever to run to the emergency department. Just the opposite. Call your doctor and get advice. So when we look at people that come in with symptoms like that, we would rule out influenza, and then there's another panel that can look at multiple other viral diseases. And also, if you think someone might have a bacterial infection, you do cultures. But when you think someone might have this because they have the right travel history, or they've been in contact with someone that has known to be positive for COVID-19, then two things are done. As far as one is a nasal pharyngeal swab, and the other is an oral pharyngeal swab. And those are put in a viral transport media, and the health department is contacted to see if they will run that COVID-19 test. And then they're assigned a number, and then those samples can be brought in and then analyzed at one of three spots. One is Chicago, the other is Springfield, the other is Carbondale. Those are the state testing labs for doing COVID-19 testing right now. So we break things into the different kinds of symptoms and what qualifies for a person under investigation. I have them written down here so I get them right. Fever are signs or symptoms of lower respiratory illness. Including any person, including healthcare workers who've been in close contact with laboratory confirmed COVID-19 patients within the last 2 weeks. The other would be a fever and signs and symptoms of lower respiratory infection, cough and shortness of breath requiring hospitalization, and if they have a history of travel from an affected geographic area within 14 days. So that would include China, South Korea, Iran, Italy, and Japan. And then the third category would be people with severe acute respiratory problems, and they're requiring hospitalization. And even if they don't have a source of exposure known, they can be tested, but you still have to rule out the other causes of that shortness of breath and cough and fever.